Regarding parathyroid hormone, it's secreted by the chief cells of the parathyroid gland. Uh, Most common cause of hypocalcemia is thyroidectomy. The effect of parathyroid overall on blood is that it increases calcium level and reduce phosphate level. On the bone, it stimulates osteoblasts to secrete interleukin 6, and activate osteoclast activity. Pulse has anabolic activity and continuous has catabolic activity. In GI tract, its effect is by vitamin D3. It stimulates conversion of 25-hydroxy vitamin D3 to 125-hydroxy, increase absorption of calcium from the small intestine. In the kidney, it absorbs calcium from the kidney but increases phosphate excretion. So overall is increase calcium in the blood and reduce phosphate. Regarding hyperparathyroidism, the patient would come with bones, fractures, stones, groans, GI problems, and psychic moans. It can be of primary, secondary, or tertiary type. Primary can be happening with adenomas and rarely carcinoma. The PTH level in them will be high, and the serum calcium will be high and phosphate will be low. Secondary hyperparathyroidism occur because of renal failure or hypocalcemia. In secondary, PTH is high, the serum calcium is low, and the phosphate is high. So it's raised phosphate causing increased PTH. Tertiary parathyroidism is parathyroid has autonomy in secretion of PTH. The patient will have generalized osteopenia and those findings. Another is pseudo hypoparathyroidism. This happens when there is a receptor problem and they do not respond to PTH. There is a high level of PTH. There is hyperplastic parathyroid glands, but the receptors are not working. Bone changes are similar like hyperparathyroidism. There is hypocalcemia, and there is no response to exogenous hormone. These patients have low intellect and brachydactyly. A classic triad would be a McCune-Albright syndrome. It has a classic triad: number 1, fibrous dysplasia; number 2, cafe-au-lait spots; and number 3, precocious puberty. Treatment for hyperparathyroidism will be parathyroidectomy if calcium is more than 2.85 millimole per liter or T-score is less than -2.5.